there is the external energy. Inborn energy to be known as a kidney essence, which is derived at the time of the conception by the parents to that infant, at the time of the embryological aspect, at the time of the implantation. The second energy after the birth, that energy to be known as a acquired energy, synthetic energy, or the original energy. Synthetic original energy indicating that heaven energy he takes after the birth immediately. That means you remember the governing of the chi to be taken place by using the pulmonary system only. The first energy is entering to the body. According to the organ clock theory as well, the original energy is entering to the body. The first energy is entering to the body through the nose, mouth to the pulmonary system, then it's entering to the central nervous system. When the hypoxia happen, that means the oxygen is not reaching on time to the pulmonary system, that infant cannot survive. When it not reaching to the brain, the whole life will be miserable for the parents and also the child, and where the mental retardation to be taken place. That's the reason started that once the cosmic energy or the heaven energy or the original energy entered to the lung system, then immediately that infant, that child started crying, indicating that oxygen is reached to the pulmonary system. Through the pulmonary system it reaches to the circulatory system, brain as well. That's the reason wherever the original energy, the matter comes here, you remember that's related to the lungs energy. Pranayama says, yoga says, and naturopathy says. So original energy you need to strengthen to your body system. From where? Through the nose, through the mouth, to the lung system, but majorly through the nose. So once you have the maximum energy, that is the governing of the energy. As I told you, there are the right side, there are the 3 lobes, left side having the 2 lobes. When the oxygen is entering to the first lobe and then middle lobe, but that's not entering to the lower lobe, then you remember the oxygen capacity is reaching to the maximum is 70%, but that's not reaching to the 100% of the lungs. So where the shortness of breath or breathing difficulty, where the carbon dioxide is coming out more, but less oxygen is entering to the lungs, which leads to the majorly lungs related problem. That's the reason how the pranayama is really good to strengthen our lungs in the purified form, where you want it to sit in the isolated place, where the good essence of the energy is existing, where the good aura is there, at the same time where the good environment is there, where there is no pollution and pollen. There you need to do increase your oxygen energy to the pulmonary system, which is majorly required to the, according to the traditional Chinese medicine, the respiration should be good, that indicating is the good oxygen, that prana, vital force, life force is required to body system. Once our lungs is received the good amount of the energy, remember that all the organs in our body, all the tissues and atoms and cells to be circulated is the good oxygen to our body system, to nourish the entire organs, to make it as a good function of our body system. So therefore you remember the respiration is very much essential, is a good respiration that to be taken place by the pulmonary system, by the external environment. Yes or no? Almighty has given this externally, but please use out of it which is required to our body system. But our life is not inside, but our life is outside. Because of the externally outside, prana is there. That prana is making the life to us to survive of the normal and healthy and peaceful and blissful and harmonious life. If the prana is not good, when the oxygen is not good, then certainly which leads to the several diseases, not only the lungs related problem, of course the skin related problem, the other many internal organs as well. It regulates the blood vessels as well. You remember the chi and then blood together, it moves. When the chi is good, the blood moves precisely. When the blood stagnation is there, remember the chi stagnation which leads to the shui stagnation, blood stagnation. So therefore, what is required? The chi is required. Each and every acupuncture patient, whoever treats by using the natural therapies, by using acupuncture, acupressure, magnetotherapy, chelation therapy, ozone therapy, then make sure that ask them to do the pranayama every day for 5 minutes to strengthen the oxygen to the each and every tissue in our body. Not only you are doing acupuncture, along with that advisable to increase the chi level which is required to promote the blood vessels precisely good. So it regulates the blood vessels. Blood vessels means all the arteries, and then venous system and capillary system. So anything get disoriented, or there is the misalignment of the artery or escape of the artery from the proper channel, then you remember there is some kind of the problem where there is the atherosclerosis or some kind of the bleeding disorder or the fat deposition or the plaque deposition in the blood vessels, where there is some kind of the embolus or embolism in the blood vessels, where there is some aneurysm in the blood vessels. All are related to the chi is not supplying to the blood vessels, which leads to this problem. That's the reason, remember always, when the chi is good, then the blood movements also good. That's the reason the lungs having the great physiological aspect to regulate the blood vessels. Wherever there is a stagnation, wherever there is a blockage on the blood vessels in the renal artery or the pulmonary artery or the pulmonary venous system or the cardiac system, coronary arteries get blockages. Anywhere is the renal artery or the pelvic artery or the genicular artery, any artery is interrupted. Remember one point to be activated, that point to be known as a Thai Yuan, that is LU9. So which is most imperative point to treat for the all the blood vessel related disorders, since that point is located on the lungs meridian itself. It promotes and controls the water passages. What exactly is the water passages? In two ways you understand. One, water passages to be known as it regulating the fluid secretions and then metabolism to be taken place in the pulmonary system. The second to be known as that's called as a mucus. The second to be known as a sweating. Perspiration is not there. Diaphoretic. When this is in fact very much essential, timely get sweating. When the sweat glands are there, when the sweat pores are there, but each and every skin having the pores, each and every area of the skin, millions of the pores are existing in our body, but that pores bring out the sweating. The timely it's required. The patient who don't get the sweating, that also leads to the disease. The person continuously gets sweating, that also leads to the illness. But all are regulating and communicating and connecting through the one particular organs, that organs to be known as a right lung and then left lung. When the skin pores open all the time, then you will get the dehydration drastically. Then always you should have the plenty of fluids all the time. Then that again it's coming out through the skin, is not good. When totally it is blocked, the perspiration, then that leads to the more hazards to the internally, which causing the problem connecting to the all the skin related problems. The morbid accumulation, the toxic accumulation which is existing inside the skin layers, that's not coming out. Sweating is nothing but is a disease, but timely should come out when during the temperature, hyperpyrexia, pyrexia condition, that time it's required to come out the sweating. So once the sweating come out, the patient feel more relaxation. Appa, I was getting the more astonishing pain in my body. Now I feel relaxation. My temperature, I feel it is less than 98 degree now. 99 degree now. How does it indicating? Urine passing is also really essential. Stool passing also essential. Sweating also very much essential to the body. If will not pass that sweating, when during the temperature, the lungs will not work precisely. It will not come out the perspiration. If the lungs quality is good, then timely it open the pores. Timely it closes the pores. When the skin pores is open continuously, many children, they told me, from the birth, after 5 years I could recognize my age is 25 years. My whole school life and college life is drastically affected, where I couldn't write the properly examination. My whole hands are, touching the sweat on the papers. What could be the reason? Certainly you remember majorly, there are the many organs are related to the sweating. The heart also reason to cause the sweating. But however, the majorly we can understand the lungs are the reason to cause the sweating. So therefore, to control the perspiration to be taken place by the pulmonary system only. If the lungs are good, then the perspiration also good in the normal level. Again, it is the weak of the lungs, always its pores, and that also leads to the dryness in the body. Always the patient will be emaciated, he cannot grow. Then it regulates the dispersity of the chi. Each and every organ, there are certain routes are there, passages are there, where I need to go. Where is my origin? Where is my insertion? Each and every muscle also having where I start, where I terminated. Each and every person journey is there, where I want to start and where I need to end my journey. In that way, this also lungs having the specific route. That route to be known as no doubt on the chest to the finger, it starts the energy. But however, the lungs energy to descend to the downwards direction energy to communicate to the internal organs. Whereas in it goes against to the nature on the upside direction, that leads to the several problems. That's the reason the dispersity of the chi that to be goes to the downwards direction, not with the all the direction, but inside that all the direction it goes. But majorly physiology of the chi to be go to the downwards direction, which is connecting to the renal organs. When the renal organs to work precisely good, then you remember it's not problem of the kidney problem. The problem is in the lungs, which causes the problem in the kidneys, and vice versa. So therefore it is manifest on the nose as well. You know, the first preliminary part of the respiratory system, any problem in the nose system, the deviation of the nose or the deviation of the bone, the nasolabial bone or the nasal, which we call as a vestibules. So once it get changes, there is the polyps are there, adenoids are there, tonsils are there, anything connected to the nose, throat and then ear. ENT. Why it is specified ENT, not the eyes as well? But there is a internally connected each and every organ. Sense organ is connected each other here. The nose related problem causes the throat related problem. Throat related problem causes the problem in the ears as well. Nose problem causes the problem in the ear as well. You look into that, the pharynx, the larynx. The pharynx and larynx is the voice box, and also there is the tonsils. The pharynx is known as a tonsils, the larynx to be known as a voice box. But if this get interrupted, that behind the nose there is adenoids are there. That adenoids are connecting to the ear system. When the adenoids having the problem, that reflect the problem in the ears as well. So therefore, Eustachian tube is affected. When the nose problem get affected, Eustachian tube is affected, the ear gets the blockages. To open that, so we should do the blow. It open the ears. Yes or no? So likewise is very much essential. It is interconnected to each other. Therefore, anything is the nose, ENT related problem. We remember most of the times is connected to the pulmonary system, that is lungs. It influences the corporeal soul. So this is in fact the soul which I told you. The liver soul is different, the heart soul is different, the lung soul is different. Likewise, each and every organ having the different souls, but this also belongs to the corporeal soul. Then chi is promoted by the lungs, as I told you, very much essential. The chi is required in the body, but majorly to receive to each and every organ to the body system through the pulmonary system. For the blood to flow smoothly, the abundance of the chi is required. You need to know the blood should be precisely move in our body system, each and every organ, each and every artery, each and every greater artery, then it is a smaller artery, further it is the micro artery, then is the minute artery, then the capillaries connecting to the venules are connecting to the vein is connecting to the inferior and superior vena cava. If this system to be corrected, that means is the oxygenated blood and then deoxygenated blood to be taken place in the body precisely good, then what is required? The pulmonary system should be work precisely good in our body system. That's the reason I advise to all of you, please do the pranayama at least 5 minutes in a day if possible. You can make it as a longer 10 to 15 minutes or maximum 10 minutes would be advisable. Keep the healthy of our lungs and not only our lungs from the head to toe, that to be regulated. Anything skin related problem. You remember skin is major issue today because of the toxic or the morbid accumulation. The colon get disturbances or there is the lungs get disturbances. So that time the sweating get problems or sweating is not balancing the fluids in our body, which somewhere it is accumulated inside the layers. How many layers of the skin? There are totally 7 layers of the skin. In between the layers, that is get the retention. Through the retention from the deeper level, it goes to the above and then surface level. That manifestation of the skin related problem. Then the skin should be purified form and make it that your lungs should be healthy always. So hopefully you understand this. Governs the chi and respiration. Inhales the clear chi and exhales the stale chi. Chi helps to propel the blood so lungs and heart works together.